Well, hi, welcome everyone to our virtual ECPI University Nursing Alumni panel event. We are privileged today to hear from four exceptional nursing graduates. They all represent the various programs that we offer here at ECPI, and they're here to share their unique experiences and expertise to inspire and motivate the current nursing students. We hope that today's panel will provide a glimpse into the diverse career paths that you can take with your nursing degree and inspire previous opportunities. And then without further ado, I would like to introduce our first panelist. You ready, Nanette?
Yes.
Awesome. So we have Nanette Hawley. She completed her practical nursing diploma at ECPI in 2019. So we'll go ahead and get into your questions. So Nanette, where are you currently working? What's your job title?
Right now, I am currently working for a couple of places. ACS, I work for Leaderstead and Chesapeake, the city of Chesapeake City Jail. Well, I'm PRN. I mainly do travel, and I am LPN.
Awesome. And then in your specific job, what are some daily tasks that you have? I know that you're primarily a travel nurse, so can you take us kind of through your different days that you have?
Well, my different days may consist of me traveling 2 to 3 hours. And from there, I'm a charge nurse at most facilities where there is a nursing home or assisted living, even corrections. I start off with making sure that I have all my CNAs there, making sure that the nurse that I am relieving, making sure that I get a nice, clean, detailed report, and counting and looking at all of my people. I might have anywhere from 20 to 30, 35 patients. I might have a trach, I might have vents, IV therapy, some of everything. A lot of diabetics, a lot of heart patients, a lot of cardiac, respiratory as well. And from there, I might do a med pass, treatments, wound care, and those sorts of things like that. And just making sure that we're doing our rounds as well as CNAs. Fall preventions is very important. A lot of times you can't prevent falls, but when it does happen, we have measures in store for that. Different things when it comes to assessing the patient when the patient comes in from admissions to readmitting, even discharging, and making sure that the medications are going out. So it's a variety of things that we do in the nursing home. And as a correction nurse, as far as intake and getting the inmates to where they're positioned to go, whether it's general population or mental health or even in medical, because of the fact that when they came in, they had a broke leg or broke hip, or
Mhm.
they might have some type of excruciating mental issue, or they might have overdosed or what have you. So we might have them in medical. So it's just a matter of placing them to where they need to go.
Yeah. So what's your favorite part about what you do in both jobs?
My favorite part is making change. I want to see change. I want to know that I was there and I was able to help. Not just pass meds, not just do the actual routine. One of the things that I did ask from God is to give me the discernment, um, that pull that I need. And for example, um, about a couple of weeks ago, I was in Richmond, and I was at a certain facility, and I wanted to start down the first part of the hallway, because that's normally how I started. I had like almost 40 patients, and I had a pull, and it told me no, start down the end and work your way up. And I'm glad that I did, because I had a patient that stroked out, and she was not even responding to me. I was doing sternum rubs and everything, and she was a full code. Thank God we got her out in time. But in situations like that, like I was about change. I was about making things happen. And that's what I love the most about my job.
Awesome. That's awesome. So let's go back to before you enrolled at ECPI.
Mhm.
What made you want to pursue a nursing degree to begin with?
Actually, it was my grandmother. She was a dialysis patient, renal failure, and she was at a dialysis facility where they decided to perform dialysis on her. They pulled out blood and they pulled out too much at one time, and then they tried to put it back in her, which caused a blood clot, and they rushed her to the hospital, and she ended up having to go. It's supposed to have been just real quick surgery, but she ended up having to go upstairs, and they gave her anesthetics and everything like that, and she ended up stroking out and having a heart attack, and she stayed comatose for like a week. I wanted to be about change. I wanted to know the necessary steps, what abuse looked like, what wound care looked like, what different things look like. Um, my thing was I was going back to school to be a social worker, and I wanted to know on that end. But again, God had another method. I ended up enrolling in Paul D. Camp Community College, where I went and got my CNA. And from there, I started looking at colleges, and I liked ECPI because of the fact that they were more hands on. A lot of schools they're strictly in the books, but ECPI was more hands on because you get all those clinical hours, and my teachers that I began to know were very hands on with me. But that was one of the reasons why I did choose it, and I'm a great nurse behind what ECPI did. They really truly prepared me for the outside world.
Great. What's your advice to the current nursing students right now at ECPI?
Um, Keep pushing. I know it's hard. I know, especially AMP. If you're at the beginning, AMP, it could be rough. Keep going. It's worth it. You're probably thinking, why do I need AMP? You will find out in the later classes. You will find out in cardiac. You will find out in farm why you need. You will find out in med surg. You will find out in the later classes why AMP is so important. Remember, retain all that information, because you will also use it on the outside. Cardiac. I know it's tough. I trust me. I know it's tough, but if you can get through that class, it's a better side. The ATIs, it's rough with the ATIs, but trust me, those ATIs, the way ECPI has it set up, it's set up to for you to win on the other side. The NCLEX, it gears you for the NCLEX. It resembles the NCLEX. It guides you in critical thinking of how you need to think. So hang in there, be tough to all the single parents. I'm a single parent. And I'm telling you, it was tough, but I got through it. I was homeless. I was sleeping in my car. I was doing it. It was rough, but I made the choice to push through. Now I have a 5 bedroom house, and my kids don't want for anything. So I'm telling you, it's gonna be tears. It's gonna be times where you cry. It's gonna be times where you be like, why? But I promise you, it's a better side once you get over it. And just keep pushing. You got it.
Thank you, Nanette. That was beautiful. Great advice. Thanks for all the insight. Um, really appreciate you taking your time to speak to the current students. I know that they appreciate it as well. So thank you so much. Great
You're
job.
welcome.
Yeah. All right. So our next panelist up is going to be Tershawn Ricks. She actually completed her practical nursing diploma with us in 2018, but then she came back and completed her registered nursing in 2022. And you were at the Newport News campus, right, Tershawn?
Yes.
Awesome. So we'll go ahead and jump into your questions as well. So what is your current role and place of work?
Okay, so I work for Riverside, and I'm in long-term care. So I work in a lifelong health facility. And some of my things that I do during the day, it's like when I come into work, I'm checking on all my patients, making sure they're not on the floor, making sure they're safe. Just checking to see if they have any appointments. Um, I'm giving, I'm getting report from the off-going nurse, passing meds. I'm doing count, wound care, things like that.
Awesome. What's your favorite part about your job?
I would have to say my patients, because like when I get there, they're happy to see me. So just to make sure that they're healthy and they're safe.
Awesome. And how long have you been in this current role?
So I've done long term care even back when I was an LPN. So
Okay.
it's been about 4 years.
Okay. And I'm interested to know, you came to ECPI for your LPN. What made you want to continue on and get your RN afterwards?
So LPN was a struggle for me. Like I really struggled in LPN. Like I had failed a few classes. I got so discouraged. Um, and when I finished, I love doing nursing, but I felt like I wanted to do more.
Mhm.
So I just decided to go back and just further my education, just so I wouldn't feel as limited.
Okay, awesome. And let's go back to before you enrolled in ECPI. What made you want to pursue the field of nursing to begin with?
Okay, so it started with CNA. I was younger. I was living at home with my mom, and I wasn't doing anything. So she encouraged me to enroll in a CNA program, and I did not want to do it at all. But I applied, and I ended up getting in. So I did it. I like my class started with like 24 students, and only four went to boards, and only I passed. So I said if I, get into it and I like it, I would keep going, and I actually like loved it. So I just wanted like to keep, to keep going with
Yeah, mama knows best.
it.
So let's go to you graduate with your RN. What made you land that first job? Like, what tips or tricks do you have for getting a job when you graduate?
So like I felt like I was really nervous during my interviews. So
Mhm.
like when I was in school, I used YouTube for everything. So I'm like, okay, like now that I'm done with school, I'm going back to YouTube. So I went to YouTube and I was like looking up videos for like interview tips and how to pass nursing interviews, and like that really gave me like confidence for my interviews. So I feel like that was a really big help for me. So just that.
Good. Yeah. So the interview's kind of the biggest part for you, and nailing the interview and getting tips that way. Awesome.
Right.
We also have a great career services team for anyone that's watching too. If you just ask your career services advisor, they'd be happy to help you with stuff like that as well.
Definitely.
So what's your current advice, or what's your advice for current students right now pursuing a nursing degree?
So just like Nanette said, don't stop. Like even if you like run into a hurdle or you fail a class or you fail an ATI, keep going. Don't ever stop. And it's like I know when I first graduated LPN, I felt like I didn't know anything. I'm like, I've graduated, but I don't know anything. And that knowledge will come once you start working. You'll start like putting everything together. So don't give up. Don't stop. Keep going.
Awesome. Great advice. Um, let's talk more specifically about the NCLEX. Do you have any advice for taking the NCLEX? Like any tips like studying tips that you had, or advice in general?
Okay, so in my opinion, the LPN and the RN NCLEX were totally different for me.
Okay,
So
because you
for the
did both.
LPN, I kind of felt like I didn't really need to study as much, which was crazy. I just did like I used what the school gave me, which was ATI, and I just reviewed lab values, and I kind of felt like it wasn't that, wasn't that hard for me. So going into RN, I wanted to make sure I was well prepared. So I just really I did lab values. I used YouTube. I used all my resources. What the school gave me, ATI, YouTube, Level Up RN. I studied so many hours a day, which I probably shouldn't have, but I would do 8 hours a day, but I would take breaks in between. So I just like when school ended, I didn't take a break. I just kept at it because I knew that I wanted to, take it right after I finished school. So I didn't take a break. I kept going. I studied every day for 3 weeks and I took it and passed it. So just don't let up.
Awesome. Congratulations.
Thank you.
So do you have any specific classes or instructors or subjects while you were going through school that has helped you the most in your specific job now?
So I would say, I think I'm say SimLab. Like SimLab was like, I loved SimLab just because like we had such a great instructor and she just kept pushing us to, and she was very knowledgeable. Like she really, pushed us to want to learn more. As far as classes, I would say MedSurg, because like I think like my first MedSurg class, like I cried because it was so much. Like we had one day off the entire term. But like it was just, it was rough, but we just got to push through. But I would say MedSurg really made me really think and apply everything that I was learning. So.
Well, thank you so much for taking time out of your day to do this panel with us. I really appreciate it.
No problem.
Great advice, great insight. I think this whole panel just really is able to show that you guys were truly, you felt all the emotions that they're feeling right now, and they can see that you guys are all saying that it's worth it, keep going through. So I really appreciate that.
No problem.
Okay, next we have Annelise Gore. She completed her BSN at ECPI just this year, so it wasn't too long ago that she completed it. And fun fact, she was actually a part of the first graduating class of the accelerated BSN program at our Virginia Beach campus. So thank you, Annelise, for joining us. You ready?
Yeah.
Awesome. So where are you currently working, and what's your role?
I just a couple weeks ago accepted a job in the NICU at Norfolk General. So I am basically thrown right in and orienting with one of the RNs on the floor and kind of just learning the role as I go. Because, that mother baby and stuff like that is such a tiny portion of what you learn in nursing school. So I have to learn so much about that 5-week class that I had and take on that role in a tinier form of all the little NICU babies.
Yeah, awesome. Well, congrats on the new job. I know you said you're still in orientation, but I'm sure you have a pretty good grasp now. You're in your second week, so you're able to kind of see and shadow. So what are some of like the daily tasks that you would have?
When we get there, the first thing we have to do is assess all the babies. So usually you have 3. So I have 3 babies I have to go in and to assess. We're always every 3 hours feeding, changing vitals on all the babies. And then depending on what's going on, you'll have vents, you can have chest tubes, you can have high flow. Some of them are only feeding through an NG tube. Some of them you actually have to sit there and like feed by mouth. So it's a lot of different working parts that you would have with an adult, but with a baby.
Yeah, it's a lot of responsibility, I'm sure.
Yeah.
And do you ever have interaction with the mothers too in that aspect? Can you talk a little bit about like what those tasks would be too?
Yeah, so parents, guardians, they can all come and visit any hours. They're not restricted to when they can and can't be there. I work night shift, so I feel like I don't see as much of the parent interaction, but you still do. You'll still have parents who will come in, especially if they're still in the hospital themselves. They don't want to sit in their room, so they'll come and hang out. But it's really fun to like be able to watch them interact and help them figure out how to navigate, building that relationship that they kind of got
stripped from.
Yeah. So helping them build that relationship and teaching them how to be able to deal with, their baby and the, whatever reasons that they're there for has been really cool to see.
Awesome. So along those lines, what's your favorite part about what you do?
I really enjoy watching, like even in the 2 weeks that I've been there, like coming in and dealing with a baby who it's like they're in the isolette and you're not supposed to handle them too much, and then you come back a couple days later and they're in an open crib, and then you come back a couple days later and they passed their car seat test and they're getting ready to go home. So that's super exciting because there's so many little hurdles that you don't realize once they're in the NICU they have to tackle to be able to come out of the NICU. So it's really nice to be able to see how happy everybody is for them to go home.
I'm sure that's an incredible feeling. It's very rewarding. So when you decided, we've kind of chatted about this before, you were going a different route in your career and you kind of last minute switched it around to nursing. What made you kind of tell us about that journey, like where you started?
So I have a bachelor's degree previously. I did the 4 years. Went to college, and I got my bachelor's in psych. I graduated in 2020, and then I got into a master's program to do school psychology. And I was super excited about it. That's what I had wanted to do. Most of my family is in education, so I wanted to go into education, but I really liked the psych aspect of it. And then COVID hit, and I was really worried I was getting into a field that was too narrow of like, if I didn't get a job in a school, I wasn't going to have a job. So I kind of like reassessed what I was doing, and nursing was always my career that I wanted to do, but didn't quite know if I wanted to like dive into that. And I was like, well, if there's ever a time to go into nursing, right now is when I would want to do it. So completely switched careers, didn't end up starting my master's program, and went to ECPI and got started on my bachelor's in nursing.
Wow. Why did you choose ECPI out of the options?
It was, most schools had a lot of like wait lists. I couldn't start for a certain amount of time. And then with the accelerated program was super exciting for me because I had already done 4 years. And so I didn't want to do another 4 years. So being able to get my BSN in 2.5 years was super exciting for me to be able to have the opportunity to do.
Yeah, that's awesome. So you also have a kind of a unique situation on how you got your job in the NICU.
Mm-hmm.
Do you have any advice to current students when they graduate, how to get that first job?
So I feel like a lot of people push you, med surg is a great place to start, or ER is a great place to start, which I agree it is. You get a lot of hands-on, you get a lot of experience, and a lot of people I felt like will kind of push you into not going into a specialty for your first job, because then you're learning, like for me, babies, and then if I was to ever change, it's kind of like relearning. But I knew once I did my preceptorship in the NICU that that's where I wanted to be. And even the recruiters at the hospital were like, oh, they're not going to take new grads. Like, you should go apply for a job here. And so I was like, no, like, I want you to submit my application to this job. This is the job that I want. And lo and behold, I got the job, and I'm really excited. So even if, you're being pushed in one direction and you feel that you want to do something else, pursue what you want to do, because it's definitely a reason that you are headed in that direction and want to do that.
Yeah, I mean, to hear everyone saying you're not going to get this job, they're not going to hire new graduates, why do you think they ultimately did end up hiring you? Like, what did you do that convinced them that?
I don't know. I think, even though in my interview, it was like, in your experience, like X, Y, and Z in your, and so even though I might not have had a lot of experience, I tried to generalize it into, if I did have this experience, how would I handle the situation, instead of just being like, oh, I don't know, I haven't had the experience, so I don't know how to answer the question. I kind of took it and spun the question to where I still could answer it, but with what I would do, or like if I did experience what I could have done, versus pulled from experience that I've had, because it's limited what I have had.
Yeah, that's great advice. Great interview tip too. So what is your current advice to students in your degree, in your program?
It's definitely super fast paced and can feel like overwhelming. But if you stay on top of it, and like Nanette was saying, the ATIs, all that stuff that you're given, it's helpful. Like, it will help you, even though it seems tedious and you have to do all these questions. It's super helpful. So even though it seems like a lot, it's definitely beneficial.
Awesome. So let's talk specifically about the NCLEX now. What were your study tips or your practices before you took it?
I was super nervous because even though we did the ATI, like, I felt like I didn't know what the real thing was going to be. So like, I didn't know if I was preparing correct. I ended up paying for some crazy study tool that, going back, like, I wish I didn't, because I didn't need it, but just my anxiety was like, just do it, like, so you feel prepared. You're prepared even if you think you're not. Just use the tools and resources that you're given. It's, for me, it was a lot easier than I thought it was going to be, but I don't know, some people struggle. I hate taking tests.
Yeah.
So I was really nervous about it. But with the ATI and all the questions that I was doing, they were so similar to the questions on the test that I felt like I had seen a lot of it before.
Good. That's great. So were there any specific classes or instructors or subjects in general that you think are most helpful in your specific job? I'm sure there is those 5 weeks that are most helpful, but anything else?
I really enjoyed, like, even patho and med surg, all those things apply to my job, even though in that realm we were learning about adults. It applies to babies in a different way. So I still think all those classes are super important. And mother baby, a lot of it you focus on the mother, not much so the baby. You get that tiny taste of like the babies and how their vitals and medications are all different. But it's a whole new world once you actually, that's like the main patient. So I don't know. I was really, everything kind of comes together and you see how all your different classes apply once you get out there.
Awesome. Well, thank you so much for your time. I really appreciate you hopping on. Really great advice, valuable advice. That was very helpful. Our next panelist is Brittany. Hi, Brittany. Are you ready? Hi. So this is Brittany Hickling. She completed her MSN at ECPI, and she completed that in November of 2022. So Brittany, are you ready for your questions now? Awesome.
Yes, I am. I'm having a lot of
technical issues.
But yes, I'm ready.
Perfect. So what is your current role? Where are you working? I know you have a unique situation as well.
So I am a family nurse practitioner. I decided to start my own business maybe a month or two after graduating. I was pretty determined that I was going to start my own business. So I started a med spa that's open. So that's what I'm doing right now in Raleigh, North Carolina. A typical day for me is coming in. If I have a consultation, I'll go through medical history with patients. And if they're a good candidate for neuromodulators such as Botox or Dysport or anything, or dermal filler, then we'll go ahead with their procedure on a different day or that same day. And it's just pretty much asking them, what your needs are, what your goals are, and we pretty much go from there as far as a plan.
Awesome. So what's your favorite part about what you do?
I absolutely love what I do. My favorite part is people coming back and saying, hey, I don't have that pain in my jaw anymore because of the Botox, or I feel more confident now that you've added more volume to my lips or to my cheeks. And just seeing people smile. And in this field, people are very appreciative. Patients are very appreciative of the service that they receive. So I just love it. I love it.
Awesome. That's great. What made you want to start your own business to begin with?
I used to always say, well, from the very beginning as an RN, I used to always say, I'll never be a travel nurse. I don't want to be a travel nurse. And I became a travel nurse. And I used to say, I don't want to work with pediatrics. And then I started doing pediatric home health and I loved it. And I still do that from time. And I always say, I do not want to own my own business. It's going to be too much work. So I was in clinical in the MSN program at ECPI, and my preceptor for majority of the adult courses, she was an MP and she owned her own family practice clinic. And she was just such an inspiration for me. And I think that showed me, I know the universal place, people in our lives that will kind of show us and guide us and lead us to new places that we never thought we could go. And she really just inspired me. She was so encouraging. At the time, I still did not want to own my own practice. But I think in hindsight, seeing her do it and doing it with so much passion and enjoying what she did, that made me want to do it that much more. And that just showed me that I could. So that was what kind of inspired me to go this route.
Nice. Well, congratulations. I think that's amazing. So you already mentioned how long you've been in your role. And when you were first deciding what you were going to pursue as a career in your life, why did you pick nursing?
So when I was back in high school, I took it was a medical science course, and my teacher was actually an RN and double major, so she did education as well. So I started to learn about the body and how things work, and I just became fascinated with it. I was in high school already, so my mind was just set that I would go be a nurse. That was a way for me to kind of put all this stuff, into practice. So that's what inspired me. And then once I got out into the field, my favorite people to work with are older people. When I was, working as an RN, I love geriatrics. And, I'm a person that people, I know that sounds very cliche, but I love to help. I love to educate. So that's what kind of inspired me to be a nurse. I can do all those things as a nurse, as an RN, family nurse practitioner, what have you. So.
Yeah. So what made you specifically want to come get your master's?
So I knew that I wasn't going to stop at a bachelor's degree. I knew I wanted to advance my education. I also knew that one day I wanted to teach at the graduate or bachelor's level. So I knew that I was going to get a master's in nursing because I know that one day I want to teach it. So that's what kind of, motivated me to come back to school to get a master's. In the beginning, it was going to be an MSc in nursing education. I went to the University of North Carolina at Wilmington, and I was like 2 courses away from finishing that program. Then I started to look into nurse practitioner school because I knew I wanted to do that too. And I can teach, I don't necessarily have to have an MSc in nursing education. So I was looking into different programs that provided a preceptor, which I later learned that people still have a lot of trouble actually getting their preceptors for those paid programs. They were very expensive. So I'm like, oh my gosh, I don't want to go into that much debt. So then I did a Google search, and I found ECPI, and I talked to a advisor. She was very, very helpful. And I just asked her, I'm like, from your experience, does anybody not graduate due to not having a preceptor? She said no. And come to find out, she was right. ECPI is really good they provide a list of people or practices that have contracted with them before. And I got all of my preceptors off of there, and I had absolutely no issue. I did not have to go and, walk into a practice and introduce myself. I called these people up. They, were familiar with ECPI, and that was that. It was just such an easy process.
Good. I'm glad to hear that. So what's your advice to current students? And it could be students in any of our programs that we have, but maybe specifically to the MSN students.
My advice as far as, the coursework would be and I had to learn this, but it was to reach out to my professors early in the term versus later on. And then you're trying to play catch up and you're stressing about all of that. But it's just to reach out to your professors. They're there to help you. I don't know if it was my pride or what, but I was like, oh my gosh, you can do this. And then, it gets to a point where it's too much to handle, and you really have to, lean on your professors and tell them, hey, this is what I need help with, because they're educators for a reason. So that would be my biggest advice. And then to study.
Awesome. What classes or instructors or subjects in your MSN program prepared you the most for what you're doing now?
I think all of the classes prepared me. There's even a class at the end of the program where ECPI provides APEA. It's an online review course. And that course pretty much helps you prepare for not only the NP board certification exam, but beyond that, you know, the importance of knowing the laws and regulations of your state as an NP and all kinds of things. So that last class was just so helpful. So
yeah, awesome. Well, thank you. Great advice, great insight. I really appreciate your time. I think we have a few questions in the chat, and if anyone else has any questions, go ahead and type it in the chat. It could be for anyone, Nanette, Tershawn, Annelise, or Brittany. But we'll go ahead and start with the few that we have, and I will look out for new ones. So what are some of the leadership takes you encounter? What are some of the leadership takes you encounter? Emily, if you want to elaborate on that or who you're asking that question to, that'd be awesome. And then Candace has a question for Brittany. What is something you learned that you wish you knew before becoming a business owner?
that's a really great question. Something I don't necessarily wish I knew it before I became a business owner. I think it was just a learning process. But in the state of North Carolina, we need a supervising physician. I already knew that part, but he was just so helpful because of like the medical legal stuff. I'm like, I don't know. So I'm able to go to him just because he has so much experience in the med spa world. And you know, since I'm in this field of, you know, owning a medical practice, he pretty much provided me different things, different forms, and different consent forms that I would have never even imagined that you need to protect yourself as a nurse practitioner, but you do. So those are some things I kind of wish I knew a lot more about just to protect myself. If it wasn't for him, I'd be in a mess.
Awesome, thank you. Well, if there aren't any more questions, like I said, thank you all for your time. I really do appreciate it. Happy Nurses Week to all of you. Thanks for taking time out of your Nurses Week, and happy Nurses Week to all of the current nursing students that are watching. We really appreciate all you do for your community. But thank you all. I appreciate it.